Welcome to this edition of the First Aid Show. What we're doing today is we're actually filming some basic life support and infection control course for dental workers. So I thought it would be a good time just to have a little break from the filming and just go through a few other things, because the dentist chair is probably about the most scary place. And if you have maybe some kind of dental injury, you might think you've got a broken tooth or you've got a problem with the tooth. You don't want to be sat here because it's very, very scary. I know for me personally, when I was a kid, I hated the dentist, absolutely hated it. I used to have dental nurses pinning me down just for an inspection. Now, not such a problem, maybe because I'm a little bit older, but also because my dentist was very good at calming you down. I had the same dentist for a long, long time now, and I actually enjoy going to the dentist, which sounds a bit sad, but it is much more pleasurable. And dentists now, compared to what they were 20, 30 years ago, massive, massive difference. Now, if you're going to have some kind of dental problem, whether it be toothache or whether it be some kind of dental injury, you need to get it checked out. Sometimes with dental injuries, it's not really a matter of going to casualty so much, because they're probably just going to refer you back to your dentist. So give the dentist a call, tell them exactly what's happened, that you need to see somebody, and they can normally then fit you in as an emergency. Now, what the dentist will then need to be doing is have a good look at what's actually the problem. So tell him how the injury happened. You need to make sure with any type of first aid emergency, they need to know what's happened, what's caused the injury, how long has the tooth been dislodged, has it been broken, do you have the tooth? So if you do have a tooth and it's out, then keep hold of it and take it with you. So you'll then do a check and have a look inside, and then they would recommend what sort of treatment you would actually need. Now, if you're coming with somebody else, then it may well be you'll bring a child to the dentist. Then not only is this child being upset by the fact that they've been maybe hit in the mouth and broken a tooth, that's not bad enough. They've then got to come back and see the dentist. So it really comes down to bedside manner. So when you're in dentist reception, try and keep the child as calm as possible, a little bit of distraction. When they come into the dentist chair, may well be sitting with them, and just to make sure you try and reassure them as much as physically possible. Because the last thing you want is getting someone too scared of it. Now, dentists now are very, very good at calming children down, but your part as the first aider, or maybe as the parent, can be a really valuable part to actually keep the child calm. One of the big fears within the dental practice would be the fear of the unknown. People don't know what dentists are up to. Now, the dentist, you're laying here in the chair, the dentist is back here. You can't actually see what they're doing. And you're always worried a little bit what they're doing behind. But if you explain to a dentist and say, I am very nervous, I want to know what you're doing, they normally will communicate really, really well with you. But they have to do things from behind, otherwise they won't be able to do the job. But often they'll come around to the side to actually physically talk to you rather than talking over your head. So explain to the dentist that you are scared, and they will help you as much as they can.